Respiratory emergencies are one of the most common in pediatric patients. It requires good assessment skills and fast interventions to prevent cardiac arrest. In this video, you'll learn how to attend to a patient having a respiratory emergency, and together, working with a qualified healthcare team, you can save a life.
Johnny, are you okay?
Can I help you?
Nurse, can you come in here? My son's having trouble breathing.
I'll be right there.
The nurse enters the room of a pediatric patient who is in respiratory distress. Her first impression of the patient can be assessed at the doorway with ABCs. She evaluates the patient's appearance, how he looks, is he anxious, unresponsive? Breathing, are there audible sounds? Is he breathing? And circulation, is he cyanotic? If the initial impression warrants immediate intervention, the nurse takes quick action. Hey, can you tell me what happened?
I don't know, he just started breathing faster.
Okay. Well, let us head up. Johnny, you having a hard time breathing? The nurse continues with the primary assessment, which can be remembered as A, B, C, D, E. The airway is assessed for patency. If there are secretions, the nurse would suction the patient. If the airway is not patent, the nurse would open the airway with the head tilt chin lift maneuver. Always allow the patient to assume a position of comfort. The next step is to assess breathing. This includes respiratory rate, effort, use of accessory muscles, nasal flaring, oxygen saturation, and auscultating breath sounds. A very slow or very fast respiratory rate is a warning sign of a potentially serious condition. Grunting is a sign of severe respiratory distress or failure. If the O2 sat is low, the nurse needs to immediately apply oxygen. The nurse assesses the patient's circulation by checking the pulses, heart rate, blood pressure, capillary refill, and skin color and temperature. The nurse will need to place the patient on a heart monitor to assess the rhythm. D stands for disability, or assessment of the patient's neurological function. Assess level of consciousness, pupils, signs of cerebral hypoxia like confusion, irritability, or lethargy. You would also want to check a blood glucose. The last step in the primary assessment is assessing exposure. The nurse will check the patient's core temperature and inspect for rashes or any signs of trauma. From the initial impression and primary assessments, the nurse can identify abnormalities and categorize this as a respiratory problem, but she can gather more information in the secondary assessment. The secondary assessment is an account of the incident from the family's perspective. Steps for this assessment can be remembered by using the acronym SAMPLE. S is for signs and symptoms, A is for allergies, M is for medications that the patient is taking routinely or has had recently. P is past medical history. L is the last meal consumed and how much. E is the events that led up to the current situation. Information gathered from the sample can be very helpful in identifying the condition. Let's look at the assessment findings again with the sample added. As you can see, this additional information helps the nurse easily determine that the patient is likely having an anaphylactic reaction to peanuts. The systematic approach to assessing a pediatric patient can ensure that correct treatment is provided quickly and that the patient outcomes are favorable.